I'm a graduate of BITS Pilani, currently working on a fintech startup based out of Bangalore.
Hi, Gautam this side. I am a graduate from IIT Kanpur and I'm currently working with ShareChat, which is an Indian social media company.
So I'm Asta and I'm also a BITS Pilani graduate.
My name is Pratyush Rawal. I'm originally from Kanpur, but I work in Delhi. I work at a non-profit called India Leaders for Social Sector. I am a graduate from BITS Pilani and also a Young India Fellow from Ashoka University. Why am I with this initiative? Because I guess that's the call of the time, I guess.
For the past 2 weeks, I have not been working on my job and focusing full time on COVID relief work in my hometown, which is Jhansi.
So I'm actually from Jaipur, but I'm helping these guys with the fundraising campaign, reaching out to people and getting funds as soon as possible so that they can procure cylinders.
Since the time that we've actually realized the scope of the COVID crisis in India this time, specifically in Uttar Pradesh and very much specifically in our own city, by the effects it had on our friends and family, I've been full-time dedicating on volunteering for our own city, raising funds as much as possible, as well as running a local help group for the people who want to get hospital beds, oxygen, ventilators, any of those kinds of helps that we can do, right? And our local group has been helping more than 20 to 30 people every day for the last 14 days. That's something that we've been able to do, but we should be able to do more with the help of your initiative.
When I saw Siddharth's post that he was trying to do something in Jhansi, I called him up and asked him that how can we club our efforts and work towards, a couple of more cities in UP.
Gautam and I are from Jhansi in UP. That is where our efforts are mostly focused on. Pratyush and his team is working on in Kanpur. And there's another BITSian who's not on this call, but Rishabh and another guy, Ratikesh. So they are working in Lucknow. So these are the 3 towns that we are currently targeting. And adjacent, because these are big cities, adjacent to them there are multiple villages, which we are now focusing our efforts on as well. So we understand that all these cities have a sufficient amount of oxygen supply, but they don't have enough cylinders to be able to transport the oxygen from the supply to the hospital or to the homes. So this problem we identified really early when we started, and hence we focused our efforts on first procuring some cylinders. However, we also are working towards some concentrators because in rural areas they are not able to supply regularly. So for that areas we are targeting some concentrators. The second part of the initiative is to provide more sophisticated equipment to the hospitals like BiPAPs and ventilators. And the third part, which is a more sustainable solution out of this whole problem, is building up a PSA oxygen plant in hospitals.
For the first phase of fundraising campaign, as he mentioned, we are trying to procure oxygen cylinders and concentrators. So for that, we are currently planning to raise up to 35 lakhs, out of which we have already achieved nearly 20 lakhs. And we've ordered about 20 units of cylinders and about 8 units of concentrators already. The rest of the amount proceeds are planned to be given to concentrators and cylinders for further 15 lakhs to be achieved in the coming week.
I guess our strength lies in being very attached to the ground and understanding what is the demand on the ground. In these 3 cities, we are coordinating with community organizations, we're coordinating with district officials, and we're coordinating with local hospitals. I guess we're constantly calling people to verify what the demand is, to understand how many concentrators do they need, how many BiPAP machines do they need, and we're vetting it very, 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 very diligently. I guess that is one of our biggest strengths. I mean, and there's one point that I would want to mention, that when I was reaching out to people for asking them for funds, they were a little concerned about working with the government, and because a lot of people feel that is a part of our society that has actually failed. But trust me, I've been talking to a lot of officials which are working on the ground, and they're working tirelessly to help us. we're very happy to collaborate with Sruchna Charitable Trust. I mean, we partnered with this trust because we wanted all our donors to have an ATG certificate for their donation so that they can get tax benefits, and that would incentivize them donating to us. And secondly, being from a non-profit, I understand that there is a very meticulous auditing and financial processes which is followed when you donate to a trust. So we want to be absolutely transparent in all our financial decisions, and that is why partnering with the trust. Apart from that, we are also working with a lot of other non-profits that have collected funds or equipment, and they would want us to help them understand where to deploy those. So we're working on partnerships with Save Life Foundation, with Mission Oxygen, with the Crypto Relief Fund, and a couple of other funds also.
The NGO that we are working with is FCRA approved, and hence on the Milap campaign, you would see the option to donate in any currency that you like. So donors can donate in any currency that they want, wherever they are located in, and we would be directly paying the vendors from that donation. This 35 lakhs, we should be able to procure about 100 cylinders and 10 to 15 concentrators, depending on the cost that we should be.
So every cylinder or concentrator is usually used for one patient each, right? And what we assume in our calculations is that for any person who gets this as an allotment, they would be probably using this for 4 to 7 days. Being on the safe side of all of these numbers, every concentrator or cylinder would be benefiting at least one patient over a course of 7 days, right? We assume that the pandemic or the second wave of pandemic would continue for a couple of weeks more, and there would be more waves in future. So if we take it as a 6 to 8 weeks of time period, again on the safer side of it, then we would be able to affect 6 times the number of oxygen concentrators and cylinders that we are getting. So if we are focusing on, as Siddharth said, 100 cylinders plus around 15 concentrators, we should be able to affect somewhere around 690 to 700 patients across the next 3 months.